about, is that that dent is exposed, what's going to happen to that dent? It's going to continue to erode and wear, and what happens to the enamel around it is it starts to chip, and the islands get bigger and bigger, and what starts to happen to the tooth? It starts to erupt. In fact, what I want you to think about is teeth are designed to be erupt into a very specific pattern where we have the mandibular buccal cusp fitting in a fossa and the upper lingual cusp fitting in a fossa. That's what we want. But when we start getting erosion, what starts to happen is you get the teeth coming closer to closer, and my concern is that the buccal cusp that used to be more in the center of the opposite tooth starts moving more towards the buccal. And if we, again, understand the importance of posterior disclusion, when we get about there, now all the back teeth can do is rub. And here's the bigger problem, is if you try to prep a tooth like this, and prep it enough to get sort of that, you know, the trapezoidal shape to be able to get a normal buccal cusp and a normal lingual cusp, you just don't have any room to get the cusps where they're supposed to be. So this is what I want you to think about. Restore these areas, all right? You're not going to go to dental hell or something. What I want you to think about is that this is preserving the vertical space, right? That's what you're doing. We all do space maintainers horizontally. We're preserving space vertically, which is hugely important because when I see these GERD patients that are end stage and there's no room, it's a tough situation. Almost all we can do is either intrude the teeth or open the bite and do all the teeth. So the more we can preserve this and prevent this from happening and understand the cause, I think it's important. So let's say this person's 18, 19 years old. If that's all you're seeing, what I'm saying is the GERD is probably stopped. You can go ahead and fill those little areas, and all we really do is we'll take a burr, a little 330 burr, maybe a little cone-shaped diamond, and go in, and you have to core out some of these the dentin. You have to anesthetize them because they'll know it when you get to the real dentin. But you want to be able to get down in there so you can bond to the dentin, and you want to get a freshened, freshly cut enamel with a chamfer type design, total etch, and use some sort of posterior composite that's going to hold up, and then keep an eye on it, right? And those will do well. And so the earlier you get there and fix the cratering, the less you're going to have to worry about the wear and tear over time.